It's now time to invite Dr. PLT Girija. I'll read a very brief uh, one pager. She has a long list of accomplishments over the last 40 years in the cause of community well-being through Ayurveda, and I'll read a little bit only. Dr. PLT Girija, who traveled with us last night, she reached IIT, took a flight, and she told me that only if you can organize your symposium on Tuesday, I can be with you, because Monday I practice and Wednesday morning I have to be at my clinic. And fortunately, it so happened that our symposium was beginning on a Tuesday morning, and we are so blessed to have Dr. Girija with us today morning. In the past, Dr. Girija has been appointed as a consultant by the government of Tamil Nadu to the Health Systems Development Project, as a consultant and trainer to the reproductive and child health programs of Indian Systems of Medicine, Government of Tamil Nadu, consultant by the Government of Tamil Nadu for mainstreaming Ayurveda, member of the governing council of Sri Sri College of Ayurvedic Science and Research, Bangalore. She was an active social worker and participant of Pen Urimai Iyakkam during its existence in the early 80s, as well as a founding member of the Patriotic and People-Oriented Science and Technology Foundation. In 2012, the Tamil Nadu MGR Medical University bestowed on her the Best Doctor Award. Dr. Girija has authored and published numerous Ayurveda and health related articles in peer reviewed medical journals, national and regional dailies, and magazines. Some of her notable books include in Tamil Ayulai Valakkum Ayurvedam. She's also authored a beautiful book on Ayurveda for women, Jeevani, Ayurveda for women, and her most recent book is Ayurveda for Revitalizing Healthcare in India, which is very relevant for our symposium, the third one particularly. Dr. Girija's societal commitment has been instrumental in starting the Jeevani Milk Scheme through Sanjeevani Ayurveda Foundation, a not-for-profit organization, to alleviate anemia and malnutrition among children in several villages. The program exists in 15 village schools of Tamil Nadu and Andhra Pradesh. Notably, during the pandemic COVID-19, Dr. Girija and her team at Sanjeevani successfully treated over 1,000 COVID-19 patients, including high-risk patients with multiple comorbidities, primarily in the first two waves of COVID-19. There are several publications, and I do have your mailing list, so I will send the detailed list of journal publications that she has published recent ones to you all, for those of you who would like to peruse them. So our session, we intended to start at 10:15. We are 14 minutes behind schedule, but we would like to give full 45 minutes to our esteemed speakers, particularly Dr. Girija and Dr. Desai. So 10:30 to about 11:10, Dr. Girija, there may be some time for questions also, and then Dr. Desai. I'll invite Dr. Desai. Dr. Girija will speak on the topic, does Ayurveda have solutions for extreme events such as the pandemic experiences from COVID-19? Warm welcome to Dr. Girija.
Namaskaram to each and every one of you. Some of you I know, most of you I do not know. I'm glad to meet all of you. The question that was posed to me was, is Ayurveda capable of handling a pandemic such as COVID-19? The answer is yes. Ayurveda and Ayur systems were the only ones who were capable of and successfully treated all categories of COVID-19 patients, mild, moderate, severe, high risk with multiple comorbidities. Public health system in India, solely dominated by modern Western medicine, had no treatment for COVID-19 except mechanical life support.
We'll give you full recording.
Central institutions like ICMR, Postgraduate Institute, Chandigarh, AIIMS, New Delhi, were the helm of affairs in COVID-19, trying to handle a new disease, an unknown virus, and treating patients with drugs which were not mandated for COVID-19. Indefinitely waiting for a vaccine to show up, what started out as a moderate fever with a few associated symptoms in the absence of any medication, was allowed to deteriorate rapidly into a life threatening situation, leading to a very high mortality in COVID 19. Central government and state governments in India failed to explore the capacity, the potential of Ayurveda in handling COVID 19. Nevertheless, much before the arrival of the vaccine, Ayurvedic Vaidyas across India treated very successfully and diagnosed a new disease. The public health system in India, from all those who were manning the public health system, from all quarters, put up a stiff resistance to Ayurveda handling COVID 19. A state like Kerala, for instance, made it a criminal offense, a medical offense, if any Vaidya dared to handle a COVID patient. There were other states also, but not so bad. In Tamil Nadu, initially we tried to get official sanction from the health department officials, but they did not, it wasn't of any use. Then we met the director of medical education of Allapathy. After a long conversation, he agreed to have us going with them, but only as a clinical trial. We have to prove the efficacy of our medication through clinical trials, the safety and efficacy. Whereas, they were treating COVID 19 patients with all kinds of drugs. Doesn't matter. The thing is, it can't be a standalone Ayurveda. It has to be done along with allopathic medication, and only one single drug should be used at a time. So we were not willing to do this. Then there was a meeting held by the State Planning Commission. That was of no use. The State Planning Commission was neither capable of influencing the state nor capable of planning anything. I don't know why it is called State Planning Commission. The next was we approached the Director of Indian Medicine. Director of Indian Medicine was out of his depths. He could not help us. Then we decided to do I was a part of two committees instituted, a multidisciplinary commission task force. It was in Delhi, and that also didn't get very far because you have allopathic doctors, Ayurveda doctors, and scientists. None of them knew what the disease was about. Ayurvedas were not allowed to handle it. So without handling a disease, how would you diagnose it? So it wasn't of any use either. Then we started a signature campaign online, an appeal to the Prime Minister. It was rapidly gaining strength. Suddenly, it just vanished from the website, and we were told we were violating the community guideline. It was change.org. So, you see how the entire system sort of, whether it is the job of the AI or whether it's the job of the people who man it, everything was geared against the Ayurvedic people handling COVID 19. Anyway, much before this, we started treating COVID patients. Epidemic in Ayurveda, just a word on that. Epidemic is known to Ayurveda. It is called Janapadodvamsham. Janapada Udvamsham, that is destruction of a habitat by the onset of a disease. And it can happen due to factors that pollute air, water, earth, and unnatural seasons. Everybody in an epidemic will get afflicted. Even if you are healthy, you are affected by it. And Charaka Samhita says there is nothing to worry. You can treat an epidemic provided you have the medicines with you, collected well ahead of the epidemic and treated on time. A word on Jwara. Jwara means fever. Ayurvedic canonical works start with the chapters on Jwara. I don't think you can add one more word to that chapter, because everything about Jwara is so thoroughly sort of dealt with. Among somatic fevers, there are so many which arise because of the numerous combinations of Vata, Pitta, Kapha. Then there are fevers residing in the seven dhatus, which are the structural entities of the body, like bone, bone marrow, blood, and so on. Then there are fevers which afflict the exterior of the body, and those which afflict the interior of the body. Then there are fevers which are intermittent in nature, like the malarial type of fevers. There are fevers which are caused by ulcers, wounds, injury, and so on. There are fevers which are long standing and chronic, and fevers which are caused by passion, anger, fear, grief, and so on. So, the chapter will give you all about fever, their signs, their symptom, the etiology, the diet, the regimen, the line of treatment, medication, and resolution of symptom, all these. So, for Ayurveda Vaidyas who are used to treating so called viral fevers of such as dengue, chikungunya, swine flu, and so on, they were quite confident of diagnosing and treating COVID 19. This particular one, we may have treated more than 1,000 patients because friends, relatives, neighbors, everybody we were treating. So we couldn't document all of them, but then those who went through the clinic, this is a database is on 781 documented cases of COVID 19, standalone Ayurvedic treatment, treated mild, moderate, and severe cases, treated patients with multiple comorbidities and high risk patients, all patients treated safely and effectively. Now, the what is called risk, I mean, those categories which has a high risk with poor outcome are the following: diabetes mellitus, hypertension, cancer, coronary artery disease, chronic kidney disease, chronic obstructive pulmonary disease, immune compromised state or a weak immune system, moderate to severe asthma, obesity, and those who are above 60 years of age. All the above mentioned high risk patients were treated. There were many with multiple comorbidities. There were many with low oxygen saturation, and very young patients were there, and very old patients were there. Very young means our youngest was 1 year old, and our oldest was 94 years old. And with the rest, okay. And then I go to, this is just to show you our first case of COVID 19 was in around March 2020. One of our patients in the midst of New York got COVID 19, and he had our medicines with us. So he was on a direct hotline every day. He self quarantined himself, and we were treating him and very closely watching his complaints. And then we knew it was a Vata Kapha Jwara. And Vata Kapha Jwara, these are the Ashtanga Hridayam and Charaka Samhita, which says what are the signs and symptoms of a Vata Kapha Jwara. I need not go into it because all of us know what the symptoms are. Around the same, little later, around the month of May or so, the Department of Ayush came up with a case record form, because I think to the department it became clear whether you have permission or not. Vaidyas people are approaching Vaidyas, and Vaidyas have started treating. So they produced an excellent case record form which had all the details, necessary details given in that. So we just printed hundreds of these. It had demographic information, chief complaints, travel history and contact history, date of onset of the disease and all the vital signs, comorbidities, medication history, then Ayurveda examination, provisional and final diagnosis, assessment, clinical symptoms, adverse symptoms if any, consent. Consent was important because the patient has to sign a consent form, and he should know that he is being given Ayurvedic medicine, and he should also be aware what medicines he was consuming, and recording of the daily progress of the patient. We had a treatment protocol. There were some inclusion and exclusion criteria. Now, the inclusion criteria is simple. Those who want to be treated by Ayurveda is the inclusion criteria. The exclusion criteria is there were some people who wanted to be treated by both. They'll say we will take allopathic medicine and also we'll take Ayurvedic medicine. So we said no. You have to take only Ayurvedic medicine and no allopathic medicine. If you are not willing to do that, it's not possible to include that. Then another criteria was that some people wanted in-house treatment. As you know that since we never had any official sanction to treat COVID patients, we could not house them and treat them at our hospital. We have a 40-bed hospital, it's a small one, but even that we could not use it because we had to necessarily have them only under home quarantine as outpatient. So sometimes a husband and wife, only two people are in the house and both have got COVID. Now there's nobody to nurse them, but it is only natural they want to be hospitalized because you have a diet, you have a regimen, you have sometimes a kashayam to make, and who is to do all this? So quite a lot had to be excluded because of this. Then the most difficult part is you have to self-monitor your own disease. Nobody is used to self-monitoring. You see, when you are not well, you are looked after. No one self-monitors. How am I? What am I? What is my condition? How do I feel today? So they had to self-monitor their conditions. And what we used to do, we were a group of Vaidyas in Chennai, all my colleagues, and every morning they would get onto the phone. And then throughout the day they are calling, checking, assessing, and the assessment on several parameters. What is the fever today? How is your appetite today? How is the body pain today? How is the urine flow? How is the bowel movement? How is your cough? How is breath? Is there any breathlessness setting in? You see, this SpO2 is not our category. We don't go by SpO2 levels. But then you will be surprised during that COVID period, everybody had that thing clipped on, what is that called? Yes. Clipped onto their finger, and whether you like it or not, they will tell you. Sometimes they will misread their pulse for the SpO2, and there was one time, the first time, it gave one of my doctors a heart attack. She said, "Doctor, somebody has a 60 SpO2. I said, "Don't worry, is she breathless?" She said, "No, she says she's not breathless." I said, "Is it the pulse? Check it." So, like this, there were a lot of things happening. And breathlessness, and then general orientation. Is there any new symptom developing? And signs of remission. They kept track of all necessary vital parameters till the resolution of symptoms or a negative RT-PCR test. And post-COVID, we prescribed Rasayana medication for recovery. This was our treatment protocol. We developed a basic drug kit. It was very small, just a couple of kashayams, a couple of churnams, and a couple of tablets. That's it. We don't use all of them on all patients. Depending on the requirement, we decided who would require what. So this was a very basic kit. I would say in more than 90% of the case, we managed with this. But this was not the only medication that we used. In many cases, we had to use other drugs. There were 3 COVID-19 waves. First wave, we treated 337 patients. The second wave, 322 patients. The third wave was a little sporadic, 122. In fact, the peak of the second wave, the number of patients exceeded far beyond our capacity. So we had to refer them to other Vaidyas. Now I'll do the first case with you. It was in May first week. There is a, there was, I would say, now he's no more. The senior most diabetologist of Chennai is one Mr. Dr. C.V. Krishnaswamy, very grand old man. He called me and then he said, Girija, I'm sending you a COVID 19 patient. Please treat her. If I send her to regular hospital, she will not survive. So please treat her with Ayurveda. We were very happy. We said, okay, we will start the treatment. Then, when we started taking down her case, it was not such a simple case. She was 57-year-old female patient. She had type 2 diabetes since 1987, hypertension since 1998, coronary artery disease since 2015, chronic kidney disease since 2013, chronic obstructive pulmonary disease since 2014. She had a breast lesion since 2019 and she had to be maintained on hemodialysis, percutaneous catheterization of the internal jugular vein 3 times a week. Now, I don't think anything is left out in the high risk case. And all right, now the line of treatment. We can't treat one thing and aggravate another thing. So we decided to go on. We would treat her with minimum medication and keep a close watch on her condition. The presenting symptoms were cough, fever, loose stools, nausea, and she might have contracted COVID 19 a week prior to that because she received allopathic treatment for cough and had completed one course of antibiotics with no relief. Only after that, they decided to do a thank you. Only after that, they decided to do a COVID test and they found she was COVID positive. So initially, we gave her Sudarshana Churnam tablet, which I'm sure everybody knows what is Sudarshan, and Dhanvantara Gutika, and she also had loose stools, some Kodajaristam, and we gave in Sarangadra Samhita, there is a very small yoga Tiruphala with Pippali Churnam. It is effective in Jwaram, that is fever, Shwasam, which is a respiratory condition, Kasam, which is cough. So that is all the medicine we started out with. And then after 2 days, we introduced one Kashayam, which is also to address her fever. In 3 days, fever touched normal, no body pain, and she was feeling quite fresh. Mild cough was present, loose stool persisted, and she had completed 9 days. But you see, the problem is not this. She is somebody who has to have a dialysis 3 times a week. And 9 days have passed, no dialysis has been done. She has missed 3 consecutive dialysis and she's about to miss the 4th one. So Dr. CVK tried admitting her in some hospital for dialysis. No hospital in Chennai is willing to touch a COVID 19 patient who is taking Ayurvedic treatment for a dialysis. They rang up 85 hospitals, and the 85th hospital finally agreed to have her. But before admitting her, they ran through a test, and the test revealed all vital parameters as per modern Western medicine were normal. There was no lung involvement. The CXR-PA view clear. Routine baseline investigation showed elevated renal parameters, but serum potassium and bicarbonate levels were maintained within normal range despite missing 3 consecutive dialysis procedures. Then they admitted her, they did the dialysis, kept her there for 2-3 days. And then on day 14th, at the time of discharge, her COVID PCR test was negative. And Dr. CVK called me in the night and said, this is possible only because of the protective nature of Ayurvedic treatment. And he himself wrote an article in Dr. B.M. Hegde's journal on this particular case. Now, there were many other high risk cases. We got a call from Ramachandra Medical University oncologist who was treating a cancer patient. He was already a gone case patient because he was on a palliative chemotherapy, and he said, "Can you treat him?" And he was treated and cured without any problem. Then there was a female cancer patient undergoing radiation, post mastectomy, and chemotherapy. She was hypertensive for 10 years and diabetes mellitus for an equal number of years. She resumed her radiation therapy after getting cured of COVID 19 through Ayurveda. In all, I think there were about 11 cancer patients. Then there were patients of low SpO2. There were elderly patients with multiple comorbidities. There was a 65, I mean, this is on low SpO2, a 65-year-old male with type 2 diabetes and anemia with aortic valve sclerosis with diastolic dysfunction, fatty liver, and hypoproteinemia had COVID 19. He had elevated CRP. The elevated levels showed 28, and when we referred, the normal is said to be 5. Its CT features were suggestive of an acute viral interstitial pneumonitis with a lung involvement of 50 to 55%. His oxygen saturation level was 79. For 9 days prior to coming to us, he was being treated with allopathic medications for COVID 19. In fact, he did not reveal this bit to us. Probably, if he had told us that for 9 days he was being treated with COVID 19 with allopathy, we would have hesitated since he hid this fact. Anyway, this was the presenting symptoms and all the details. We took him on, and he was very safely treated and cured of COVID 19. Now, a male 80 years of age with COPD for 2 years with an SpO2 level of 76% made a steady recovery. A female 65 years old, diabetic, obese, and symptoms of breathlessness, blood streaked sputum, loose stools, and fever with an SpO2 of 76% made a good recovery. Her son, who was nursing her, said when she walks to the restroom, her SpO2 level drops to 60s. And in this case, they used a portable oxygen concentrator. And when the concentrator was used, her level increased only by 2 points. It went from 76 to 78, not beyond that. And she recovered slowly, steadily, and we gave her very good post COVID medication, and she was very well. Now, there was one cardiac surgeon friend of ours called and said, "There is somebody known to me deteriorating in an ICU. Can you please give medication?" I said, "It is all right on home quarantine, but how do we give medication in the ICU?" He says, "That is not your problem, you just give medicine." And this patient, not very old, maybe in his 40s, maybe, and he made a very safe recovery. And then he came back to us and said his entire clan visited us. And then he said, "I was seeing one by one in the ICU people passing away, and I was getting ready myself. With the first dose of medication, I started feeling better and I started getting back to normal." I still regret that I didn't ask him, "How did you smuggle these drugs into an ICU of a hospital?" Elderly with multiple comorbidities. A wheelchair bound 87-year-old female with a long history of chronic cardiac disease, recovering from a recent heart attack, diabetic, hypertensive, made an uneventful recovery. 92-year-old male who was hypertensive, undergone coronary artery bypass grafting for CAD with a history of tuberculosis and a recent burn injury and on a permanent urinary catheter, was treated safely with Ayurvedic intervention. The treatments were effective, safe, for elderly with multiple comorbidities. For more details, we have written an article in one of the journals on high risk patients and Ayurvedic treatment COVID 19. Now, mortality. We had 3 fatalities in all these. One was an outstation patient. He was 78 years old. By the time the medicine was taken to wherever he stayed, it was night time. Maybe he would have had one dose in the night, but next morning, our very first phone call we make, and the doctors made the first phone call, he had already passed away. Maybe at best he had one dose, and it was no fault of Ayurveda or no fault of the medication. But since we had recorded him and taken down all the details and given medication, we had to record this as one case of mortality. The second case was a 88-year-old male patient whom we admitted on compassionate grounds. He was a heart patient, diabetic, suffering from total dementia. He was bedridden. He could not communicate at all. No hospitals would take him. The son had to personally nurse him. And he begged us. He said, I don't care even if my father passes away, but please take him on. So we took him, we gave the medicine. He passed away, but his son, who was nursing him, kept taking the medicine that was given to the father. He never even contracted COVID 19. So he was one of the many who came to meet us because, we were treating all strangers. Usually we have patients, new ones, old ones, but in COVID times, they were all strangers. They didn't know who the doctor was, they didn't know who the patient was, they didn't know anything. They were not familiar with the names of the medicine, how to make kashayam. On top of that, we have instructed diet, regimen, everything. So total strangers talking to totally new people, but they were all very touched. A lot of them came and met us because they got so used to hearing the names of, here is Dr. Nitya or Dr. Vani or Dr. Pallavi or Dr. somebody every day calling them. They started looking forward to those calls. And every day they will meticulously tell us, this is how I feel, this is how I'm not feeling, this thing, that thing. So it was it was a very different kind of interaction we had with the patients. So a lot of them came to meet us, and he was one of them who expressed his gratitude. Then there was a third mortality. Is again, we ought not have accepted him because ours is a standalone Ayurvedic treatment, but he is known to one of the treating doctors. So a male, 85 years old, he was double vaccinated, patient of COPD for 8 years with reduced kidney function, and a heart patient. He was already being treated with steroids and paracetamol for his condition, and he started Ayurvedic treatment after 5 days, and he was one of the persons who passed away. So this was the mortality in our treatment. Now, how did we treat this people with breathlessness? That is what you call the low level of SpO2. Now, in Ayurveda, to treat this kind of condition, that is incessant cough and breathlessness and so on, Shwasam Kasam, we have a dosage called Muhur Muhur. Muhur Muhur means frequent administration of a dosage of medicine. And we put together for these kind of patients a group of uh, drugs, which this is drugs that went into it, and every now and then they are asked to take it. So this is something I wanted to point out to you. The other thing about Ayurvedic treatment, what we usually hear is, they may know nothing about Ayurveda, but everybody will say Ayurveda uses a lot of metals and a lot of minerals, and it is very bad for the liver, it is very bad for the kidney. And in most cases, as I said, we didn't have to use it, but we also used Hemagarbha potali, which has metals in it, Malagarbha Potali, Shwaskutar Ras, Jaimangal Ras, Tribhuvanakirti Ras, Vayugutika, Magarantwaja. All these have metals in it, minerals in it, and they all were safe and very effective for our patients. In fact, Jaimangal Ras is one of the finest drugs you can come across in the Ayurvedic pharmacopoeia, which is from I just wrote the sloka because I got carried away and I wrote it down. Just about anything and everything which can be named. It says, Nikilam Jwaranamanam Hanti. Whatever you say in the name of Jwara, fever, this drug is effective. Anyway, we didn't have to use it much, but in some case we did. Now, I would like to point out some of the highlights of Ayurvedic treatment. One thing, there was no deterioration of patients under Ayurvedic treatment. We could arrest at whatever stage the patients came to us, we could immediately arrest the progress of the disease and then take care of it. There was very quick resolution of symptom. It didn't take us long. In fact, when we put the whole thing in a graph, plus minus 6 days was what was showing. Ayurvedic medicines proved to be safe and effective, and the entire treatment cost was a minuscule when compared to mainstream allopathic treatment. If you want to know, we charge them from day one till the resolution of symptom, entire follow up, including medication, 3,000 rupees. In fact, some of our patients said, "Why are you charging so low?" But an epidemic is not a condition where you are supposed to make money. I mean, it was very revealing to the public how, if the public health system had made up its mind, it could have very well taken charge of the situation at a very low cost and with far better results and very low mortality. Now, these are some of the, I can't even see. Some of the demographic data details. There was 419 female patients, 362 male patients. There were 419 females, 362 male. Those who were above 30 BMI were 118. Those who were above 60 years of age were 184. Those with diabetes 124, hypertension 113, cancer 11, asthma 46, COPD 8, CKD 5. Oh, COPD, CKD, chronic kidney disease, CKD 5. And then there were those with the respiratory symptoms were 594. Other than respiratory, 153, asymptomatic 34, more, and those with more than 3 symptoms, 544. Then this is also graphic picture of symptomatic patients and patients with comorbidities. One morbidity, 2, 3, multiple, and so on. This is the number of patients versus symptoms, various symptoms that weakness, fever, cough, sore throat, diarrhea, etc. Then recovery days, you see plus minus 6 it comes to. Then age-wise comorbidities and risk factors, those details are there. These I have published it in one of the journals. And age-wise recovery is also there. The younger age group got over it sooner, but everything on an average plus minus 16. There were 1 or 2 of them who took 2 weeks, a few of them, but averaged it to 6. In fact, my worst case of COVID-19 patient, I have not put it down here because it was a case of a 72-year-old who had no comorbid condition, perfectly all right. Already after 3 weeks of allopathic treatment with steroids and blood thinners and all that, he had developed swelling of the arms and feet and breathlessness and heart rate. Even one step would rake up his heart rate to 140 and who was in a very bad condition. And after 3 weeks of treatment, the treating doctor said that he is much worse than where he was when I started out with. This was one case where I personally sat next to his bed for 24 hours vigil for several weeks and pulled him out of it. The first thing I did was to strip him off all the drugs that he was taking, that steroids. I could stop it in 2 or 3 days. The doctor said it can't be stopped abruptly, so reduced it in 3 days or 2 days, and then the blood thinners and everything else, and it was not easy. So that I would say was the worst case that I treated. Retrospective analysis. Ayurvedic treatment for COVID-19 was safe and effective. It handled mild, moderate, severe, high risk patients with great efficacy. Mild ones received minimum medication and it arrested the progress of the disease. Severe cases received more intense care, effectively preventing deterioration of their condition. Case of hypoxemia. 93 is supposed to be, they would start panicking that is going into hypoxemia. You saw our cases, how low the oxygen saturation levels were. Wherever there is a severe cough, breathlessness, then we would introduce this muhur muhur. That would be a certain dosage in the morning, 7 o'clock, they will start. And every 1 hour or 1.5 hours, they'll take a small quantity out of that. So in a day, they would have, in 12 hours, they would have taken some 10 doses of that medication. So this is what we used in the case of low SpO2 or breathlessness and so on. And severe case of COVID-19 received many RASA drugs with no adverse effect. Those with SpO2 in the 70s, this you must remember, were well into an acute and progressive stage of the disease, indicating severe pulmonary pathology. Severe case with pneumonia required hospitalization with intensive care and respiratory support. And you saw how Ayurveda could treat them under home quarantine without any of these mechanical life support. Despite poor diagnostic features, all those who tried Ayurvedic medicines recovered fully. Now, the problem was in modern Western medicine, no treatment or prophylaxis which could protect or prevent the disease existed. They could not prevent the disease from progressing into a very quickly into a serious condition. Zinc, vitamin C, antibiotics were not relevant for COVID-19. Remdesivir, dexamethasone not mandated for mild and moderate cases. High use of steroid and blood thinners led to post-COVID complications. Relying heavily on mechanical support system and self-limiting nature of the disease resulted in very high mortality. Now, the points we need to look at is, one thing which is very interesting about Ayurvedic Chikitsa is, there is not a single universal medicine for Ayurvedic treatment. If there are so many doctors treated COVID-19, each of them used a different set of drugs. Once you know it is a Vata Kapha Jwara, each doctor is free to use whatever drug they are familiar with, which is available in their place, and you could treat COVID-19. It is not that there's one drug which we have everywhere, everybody has to follow. So there was no single universal medicine used in COVID-19. Medicines were safe and effective for all categories of patients. Quick resolution of symptom among patients, including those with comorbid conditions, at a very low cost, very low mortality. Ayurveda could diagnose and treat with ease. And had it been allowed, now you think, I have presented the case in front of you. Had this public health system taken on Ayurvedic Vaidyas seriously, there are more than 4 lakh Ayurveda Vaidyas in this country. Had they been allowed to play a central role, would this have happened in this country? It could have happened elsewhere, not in India. In fact, in China, they used in the first wave, they used TM's traditional Chinese medicine. and they officially acknowledged it in their website, and they called it their jewel. Now, what did Indian public health people do? They knew very well. They were so hostile to Ayurveda handling it. And even today, what is happening? They've all turned a diplomatic blind eye towards this explosive issue. They don't want to talk about it. Everybody knew Ayurvedic handled it. Is anyone talking about it? Today, there is some influenza coming up, and they're talking about adult vaccination. Newer and newer diseases will keep appearing. For each new disease, are you going to come up with a vaccination? So, I don't think our public health system, I mean, the officials handling the public health system and our policy makers care to see what is good for our people and how we are going to resolve this issue in India. This is Vikara Nama Kushalo. Again, Ayurveda tells you how to handle a new disease, because the very same doshas will again and again will produce newer and newer diseases depending on the etiology, the causes, the seat of affliction, and so on. So, Ayurveda will tell you a physician should quickly comprehend the nature of the disease, the doshas causing the disease, the site of its manifestation in the body, and the etiological factors, and get quickly cracking with the disease. Thank you very much.
Any quick questions? Young, old, medical, non-medical, all people are welcome. There are a lot of BTech students here not looking at Instagram. You're also welcome to ask questions. Yeah, Keshav. Yeah. Be loud. Yeah.
As newer and new diseases are being
Come up. Can you hear?
I can hear.
As we know that new viruses are coming, like the COVID, and they are evolving. So you think that Ayurveda can be able to cure them? I mean, like we need new technologies and upgradations in the medication. So Ayurveda can be able to handle that viruses.
Ayurvedic people have been, can you hear me? Have been treating dengue, chikungunya, swine flu, H1N1. All these are virus in origin, supposedly. But we did not read virus there, because the Ayurvedic science categorizes the causative factors as combination of doshas, etc. And so for us, the whole thing gets condensed into a certain theory, and once we only need to identify the nature of the disease and find out what is the etiology and what is the, from the symptoms, etc., what is the etiology and what are the causes, what are the doshas which are participating, what is the nature of this illness. So newer and newer diseases will always come. It's been there in the past and future also. I mean, Microsoft, I don't know who that, you can't be coming up with vaccines for every disease. So you don't need it. India doesn't need it. America may need it. India doesn't need it. India has still a strong system of its own medicine. And instead of trying to integrate, I don't know what integration means. I mean, you allow each system to play a certain role, and especially in primary health, Ayurveda should be your first option. Have I clarified your?
Please, Keshav said. Yeah, there are other questions. Professor Ritupriya has a question. One moment. Yeah, please go ahead.
I really appreciate the data you shared and
Thank
the
you,
experience
Rita.
that you shared. Which is so
I've known you for so long.
I was just wondering, since in Tamil Nadu, Siddha was used a lot during COVID as well.
Yes.
What was your experience? What did you think of the way Kabinson Kudineer was being used at a mass level? No, because these were specific individual patients, but that was a mass use. So.
Yeah, see, the Siddha was also used, and Siddha was also effective, and the divide between Siddha and Ayurveda is a little contrived. In fact, if you look at the Kavasura Kudineer ingredients, which is 90% what we call Bharangyadi Kashayam, And so it was effective because especially Kafam and Vayu, it was effective, and they used similar medicines. So in the first wave, the Tamil Nadu government distributed some to in public, but no serious attempt was made. They did distribute some Kabsura Kudini to some households, but you see, how can one? I mean, does any state government have the guts to take an independent stand again? Although I heard later somebody recommended some medicine to this particular person. I don't know if it is true, Chief Justice of India earlier said he took for COVID-19 Ayurvedic medicine and he got better. So Ayurvedic medicines are only meant for Prime Ministers and Chief Justices and Supreme Court judges and all the elites of this country. And what about our people? They all quietly took Ayurvedic medicines, and our people were allowed to die taking any damn medicines.
What we see is that the larger health programs or the public health programs in our country, they are hinged upon the modern medicine or the allopathic systems, right? All the public health programs, the community programs, they are sort of central to the public health solutions that we have. And whereas what we have been talking is that how can we get Ayurveda, because so how can we sort of have more sustainable programs where Ayurveda can actually play a central role for public health in India.
Ma'am, but that is your job.
Yes. We are trying, but the support is sort of negligent. The understanding is also very less, and that's where I'm trying to explore that how can we, build this up further.
I think if you are serious about what you are doing, you will find an answer. Most of our people are not serious.
Madam, you were serious, and all your clinical practices, you know the whole background, and you know the public system. What is the course of direction that you would suggest to this committee to make government hear about Ayurveda's role today?
Anyway, people are coming to us, and it is our duty to treat. That was our attitude. So initially from the local police station and all, there was a couple of visits and one CID from somewhere came. Then eventually those police and all came, took medicine and went for their relatives all over the place. So I think one thing, Vaidyas simply have to do their duty, whatever may be this is not in our lifetime. I hope there is not another pandemic. But nevertheless, I think we have a responsibility. We owe it to our people. Healthcare and a system of medicine. I mean, look at the anemia and anemia among children, anemia among women. This National Nutritional Anemia Prophylactic Program has been going on for the last 75 years, I don't know, 80 years. Have we gone beyond our anemia, malnutrition among children? We have the most stunted children in this country. We can have short-term intervention based on Ayurveda. No, we can have short-term intervention based on Ayurveda to tackle anemia and malnutrition. But we don't think like that. We think of high-tech interventions, how to make rice into a paste and then put fortify it and then recreate rice and then dispense it through. I mean, in fact, in one of our Jeevani program, which Professor mentioned, we found, when we did a survey, the amount they were spending on healthcare and medicine in terms of going to a doctor, buying the antibiotics and whatever, the same amount only it cost us to run the program, and the children stopped falling sick. There was no illness and they became very robust. And in one of the villages, it was in Tirukazhundram or somewhere, the local, they are so used to every day the one set of children being taken to it was a orphanage, children to the local hospital. When they stopped falling sick, they stopped going. And the doctors started asking, have you started going to some other hospital? So, you see, you can have a short term program, but you don't want to think about it. You want high tech solutions. You want to see how AI can be introduced into it. There is no single medicine which you used for COVID 19. How will you reign in Ayurveda? If there are 4 lakh doctors, they use 400 different medicines, different combinations. Unlike Western medicine, you can build an industry, a corporate industry on it. You know, it is the biggest, next to arms and ammunition, it must be pharmaceuticals. So you see, one need to think. As Indians, we need to only worry about ourselves. We need to see how we are going to resolve our problem. I'm sorry, I know you're not Indians. I really don't know what you're doing. Sorry. But we need to see, as Indians, how are we going to resolve our problems and not answer to all international questions. How are you standardizing Ayurveda? We don't have to answer to them.
We'll have a more elaborate discussion.
I think
on
it's
this,
you can have a
for many
different.
people, so I don't want to say something. I'm just stopping myself, Sujit. I'll talk later with you in more detail. I want to thank Dr. Girija. There is a lot of time. She's with us till afternoon, and there will be very frugal lunch, very unconference-like lunch you're going to be subjected to. There will be a lot of time. There will be less paneer, less government budget spent on lunch, very small lunch, a lot of time to ask Dr. Girija this question and patiently listen. She answered this question already during the talk. Thank you so much, Dr. Girija.
I hope
Yeah,
I hope we don't call it Ayurvedic lunch.
It's a very simple, small lunch.
Can I have?
Unconference like. Yeah, I will come back to you in a
Okay.
minute.